body working better first. And if that didn't fix the problem, then maybe we're just not producing enough neurotransmitters. And we need to change our nutritional therapies in such a way that we can produce more of these. But it's a pretty simple test. And basically you just collect a couple of urine samples, send it off to a lab, and they give you a printout of neurotransmitters. If anyone's interested in anything like that, there's a pamphlet on that, which is really a good pamphlet. It talks about neurotransmitters and their role in health. They're laying up here, so feel free to grab one if you're interested in that. Otherwise, I don't have anything else to say.
You touched a lot
Yes.
on nutrition, and I wondered how you feel about the Diet Aid Ally that they've been advertising so heavily over the past year.
Ally is just a 25% dose of Xenocal. And I think that, if all it does is basically blocks fat absorption in your body. So if you like oily stools, you like oily poop in your pants, and you like to fart a lot, then that might be a good option. So I don't care much. So I'm not a big fan of it. I think you can do so many other things. I talked to you guys. Didn't get to come to my what was my thing I did last night? I got a brain problem today. I feel like I'm punch drunk. I've been talking to so many different groups about so many different topics, but 8 puzzle pieces to losing weight. And if you incorporate all these puzzle pieces together, like fiber, like balancing hormones, making sure that you're detoxified properly, making sure you're breathing, you're exercising, make sure you have proper diet, make sure you control inflammation. A lot of times, your weight's going to take care of itself by following those guidelines. So I'm not a big fan of Ally. I'm not a fan of Xenocal. I just think that and I really don't believe fat is our enemy anyway. I believe sugar's the enemy. And I think the lack of control of blood sugar metabolism, the lack of balancing blood sugar metabolism through the course of the day, that's what gets us in problems. And as far as weight's concerned, lack of good blood sugar metabolism leads to excess blood sugar in our blood vessels, which then gets converted to fat anyway. So,
but how does that affect the nutritional absorption, since that probably mainly works in the large intestine, where you're getting a lot of your nutrition from? Doesn't that then put the individual who's taking it at a higher risk for nutritional deficits?
Well, I definitely think it would. Especially if it blocks the absorption of the good fats. Fat's not a bad guy. There are bad fats, hydrogenated and trans fats, like we talked about. But the other fats in our body, the essential fatty acids, alpha-linoleic acid, gamma-linoleic acid. There's a whole bunch of acids that are important for cell function. So I just think that's a bad thing.
Well, it doesn't discriminate in which fat it blocks either.
It blocks it all.
Yeah.
Then it winds up in your underpants. A lot of people. I'm overly graphic. Doesn't do that to me.
That reminds me that I think it was a Saturday Night Live skit about medication and then all the side effects, and there was a skit all about that, about all the side effects of medication.
But the side effects are the biggest issue I think with most patients. If you could take Prozac and didn't have any other side effects from it, I guess who cares? Don't worry about it. But it's these side effects. It doesn't matter if it's heart medication, diabetic medication, or whatever. It's the side effects I think that are so difficult for most people to deal with. Other than the fact that you're just treating symptom, you're not treating cause. So, Susan?
I have a question about the anti-inflammatory diet, and one thing that you should not eat is grains. And I always thought, like wheat, quinoa, we eat brown rice a couple times a week. We always thought that was good for us.
Yeah, and I would say it might be good for you if you don't have a gluten sensitivity. And what I've found, and I think the scientific literature will support what I'm saying when I say this, is that people that have gluten sensitivity, wheat, barley, rye, substances, grains, people that have an extreme reaction, that have a condition called celiac disease. I mean, really devastating. What we have found, even through doing salivary hormone testing, I bet probably 50% of the patients we've tested have a gluten sensitivity. So what it does, it creates a low-grade inflammation that's in your body just constantly. So what I would recommend this is, if you suspect that might be a case or not, you can either do a salivary gluten test, which costs about $40, or what you can do to see if you are gluten sensitive at all is eliminate from your diet for 6 weeks and then reintroduce. So do an elimination and reintroduction diet. So pick a favorite grain that you eat. Don't eat it for 6 weeks. And then every 3 days add another grain to that to see what kind of effect it has on your body.
But if we were sensitive, we would have like bloating or indigestion or...
Yeah, you might. It may be so subtle you don't even notice it. And even when you stop eating the grain for that 6-week period of time, you don't really notice any symptoms until you start taking it again. You reintroduce it back into your diet again. So if you were to eliminate wheat product, for example, or even dairy, you could do the same thing with dairy products. But if you had eliminated wheat for 6 weeks, you may not notice that much of a change in how you feel. It's only when you reintroduce it. You'll notice, well, maybe you're bloated, maybe you're cramping, maybe you've got mucus formation, maybe you're more lethargic, maybe you're not sleeping as well. But a lot of people, it's amazing, are gluten sensitive. So it creates this low-grade chronic inflammation that's ongoing in our body, most of us anyway, all the time. So, yeah, so I would say, yeah, grains should be a good thing. For a lot of people they are, for a lot of people they aren't.
Can you touch a little bit more on breathing? You mentioned how important deep breathing is and how often we fail to do that, just stopping to breathe and, you know, just kind of the best ways.
Yeah, what I would do, you know, I think you should take 3 or 4 times a day to stop for a minute and just do some deep breathing exercises. And when you, is that what you're talking about, Amy? Or just like deep breathing exercises?
And how it increases your lung capacity, which then gets more oxygen into your system.
I like Amy sitting there. She always asks me great questions. I said, what do you mean to sit Amy today? I said, sit her right there, because she always asks me good questions. But anyway, so when you breathe, you should belly breathe. You know, when you think about breathing, you think about your lungs. You know, I always visualize my lungs as being like a big glass. You think about air as being water. And if you were to fill a glass of water, it fills from the bottom up. Then you want to do the same thing with your lungs. So when you breathe, what you want to do, when you take a breath in, you know, your belly should start to stick out. So as you breathe in, and then when you blow air out, suck your belly in tight and flush all that air out of your system again. But be real deliberate about that kind of movement. And do that about 10 times, whenever you think about it through the course of the day. Because, you know, one thing, most of us are shallow breathers, you know, whether because we're stressed or we're talking a million miles an hour like I am right now, or whatever the case might be. So you're really very shallow breathing. You're only breathing and using the upper part of your lungs. Well, you know, the old adage, you don't use it, you lose it. You know, whether it's a bicep muscle or whether it's your lungs, it applies to everything. So the breathing is not only important to get oxygen into your system, but it's also very important so you get total use of your lungs so they don't become dysfunctional over time. And you look at the incidence of COPD over the past 10 years or 15 years, it's just skyrocketing too. You know why? Well, maybe it's the air we're breathing, maybe it's because we're not smokers, maybe it's because we do smoke, or maybe it's because we're just not breathing right. So we're losing lung function because of that. They make these little lung exercisers. Is Sandy back there? Tell her to get on top of the cabinet where my spot is. I need one of those breathing ones. I have my little spotter to put all my junk in. Because I carry so many bags around, I've got stuff all over this office. I have a spot now to put my stuff. But anyway, you get these little lung exercise units that actually force, you know, when you take a breath in and exhale, it actually have to do it under there's a little diaphragm that makes it difficult. So it actually exercises your lungs. They're the neatest little things. They only cost about $12. But that's another thing you can do with the deep breathing exercise, is be able to breathe in, breathe out with this lung exercise device, because it creates resistance. Resistance in, resistance out.
They use it a lot, I'm not to interrupt you, they use it a lot after surgery. To make sure that they're breathing deeply and helping with
this one's cooler. Let me tell you, because my appendix ruptured about 6 years ago, so I had that clear container with the ball that's up and down. You know, because it was almost turned into a game for me. But this thing you can put in your pocket. So whenever you're just walking down the street, you can stick it in your mouth and you can start doing some deep breathing kind of exercises. It's a neat little device.
It's a really good way to relax too. When you get into bed and you're trying to relax, and you got all the day's activity going through your head, to just focus on 15 deep breaths, where you place your hands on your stomach, feel your stomach rise, release it. It really puts you into the most deepest sleep. Honest to God.
So you don't have to take no medicine.
No medication. It's like every time you breathe out all the stress of the day, and take back in, you breathe out, and just kind of.
So stress, increased oxygenation, breathing reduces cortisol levels in your body, so it helps manage blood sugar better. So it does a lot of good things for us. We don't think about doing it because we just don't think about it.
I hold it, breathe real good, and slowly